Hello everyone and welcome. In this video we'll be discussing a topic of great importance, dementia. This condition doesn't just affect those who suffer from it, but also their loved ones. Recognizing the early signs can make a huge difference. It allows for timely actions that can slow its progression and improve quality of life. Dementia is a progressive neurological disease that affects millions of people around the world. As life expectancy increases, the number of cases is expected to rise. Early symptoms are often mistaken for simple forgetfulness or minor slip-ups, but it's crucial to recognize the warning signs. In this video, I'll be sharing 10 early signs of dementia you shouldn't overlook. My intention is not to alarm you, but to provide valuable information so you can identify potential symptoms early and take action. We'll also talk about some strategies for managing this disease more effectively. Before we begin, let me know in the comments how old you are and where you're watching from. Don't forget to like this video and subscribe to the channel so you won't miss more content related to health that could make a real difference in your life and in the lives of your loved ones. Changes in movement and posture. How a person moves can reveal a lot about their neurological health. While dementia is often associated with memory loss, it can also affect mobility and motor control. One of the first signs might be a change in how someone walks. Shorter steps, slight dragging of the feet, or a hunched posture. Some may stumble more often or struggle to keep their balance when standing or walking. These changes tend to worsen over time and increase the risk of falling. Fine motor coordination can also decline. Everyday tasks like buttoning clothes, tying shoelaces, using utensils, or even writing may become more difficult. Movements might feel clumsier, slower, or less accurate. People may drop things more often or find it hard to grip them firmly. If these issues happen regularly and without an obvious cause, like a past injury or diagnosed muscular condition, it's wise to consult a neurologist. Early diagnosis allows for better management and can significantly improve quality of life. Changes in the senses. Sensory changes are often overlooked or blamed on normal aging, but they can be early signs of cognitive decline. For instance, difficulty judging distances or depth perception may cause problems with spatial awareness, leading to tripping, parking difficulties, or trouble navigating stairs. Some may struggle to recognize familiar faces or read clearly even without a diagnosed vision issue. The sense of smell can also be affected. Research shows that loss of smell is an early indicator of neurodegenerative diseases, including dementia. Familiar scents may fade or disappear completely, which also affects taste and can pose safety risks, such as not noticing gas leaks or spoiled food. Hearing loss is another important factor. Difficulty hearing forces the brain to work harder, affecting concentration and increasing isolation, which can, in turn, accelerate dementia. If persistent changes in senses are noticed, a specialist should be consulted. Early detection helps implement strategies that improve life quality and slow progression. Loss of muscle strength. Muscle weakness is another early sign to watch for. Not just fatigue or tiredness, but a gradual weakening that may be linked to brain function. Studies suggest that weaker hand grip strength is associated with a higher risk of developing dementia. A weaker grip might make it hard to open jars, hold utensils firmly, carry bags, or even turn a key. This isn't always due to aging or inactivity, but could signal a disconnect between the brain and muscles. Muscle strength is increasingly recognized as vital for brain health. Physical activity promotes circulation, oxygen flow, and supports neural connections. A noticeable decrease in strength, especially without a clear cause, could indicate the brain is having trouble sending the right signals. If someone feels sudden weakness doing tasks that used to be easy, it's best to seek medical advice. Staying physically active with strength and coordination exercises may help reduce cognitive decline and improve overall function. Sleep problems. Sleep plays a vital role in brain health. During sleep, the brain clears out toxins, consolidates memory, and restores key cognitive functions. That's why disrupted sleep patterns can be an early red flag. Common signs include waking up multiple times at night without reason, struggling to fall asleep, or waking up too early. Some may also experience vivid dreams or disorientation upon waking. Excessive daytime sleepiness, falling asleep in inappropriate situations, or feeling unusually tired can signal that the brain isn't getting the restorative rest it needs. Some people may have involuntary movements during sleep, like limb jerks or sudden posture shifts, which could be linked to disorders like restless leg syndrome or REM sleep behavior disorder. These have been associated with a higher risk of cognitive decline. Research shows that poor sleep contributes to the buildup of beta-amyloid proteins in the brain, a key factor in Alzheimer's. If sleep disturbances are frequent, it's essential to seek medical guidance. Good sleep hygiene, consistent routines, and avoiding stimulants before bed can all help protect cognitive health. Lack of interest and social withdrawal. Apathy is an early symptom often mistaken for depression. It can appear as loss of interest in previously enjoyable activities like reading, listening to music, or spending time with friends and family. Social withdrawal is another sign. The person may avoid gatherings, decline invitations, or engage less in conversation, sometimes because it's hard to follow dialogue or recall recent information. Lack of initiative in everyday activities like cooking or going for a walk can also reflect cognitive changes. These signs tend to worsen over time and affect both the individual and their loved ones. Language difficulties. Occasionally, forgetting a word is a common part of everyday life, but when word-finding problems become frequent or when familiar terms are replaced with unrelated ones, it could be a sign of cognitive decline. Individuals may have trouble following or contributing to conversations, lose their train of thought, or repeat the same phrases without realizing it. In some cases, they might describe an object indirectly, saying things like the thing you write with instead of pen, because they simply can't recall the word. These communication challenges can increase over time, making it harder to express needs or understand others. As a result, the person may become frustrated or withdraw from social situations out of embarrassment or confusion, leading to feelings of isolation. Recognizing these changes early and responding with patience and support can make a significant difference in maintaining confidence and connection. Forgetfulness and disorientation. Misplacing things from time to time is normal, but when items begin turning up in unusual or illogical places, such as finding keys in the refrigerator or a phone tucked into a sock drawer, it may signal something more serious. Often the individual has no memory of putting the item there and might even accuse others of moving or taking it, reflecting a deeper level of confusion. As dementia progresses, this forgetfulness can go beyond objects. It may begin to affect the ability to remember important dates, recognize once familiar places, or carry out daily routines in the correct order, like getting dressed or preparing a meal. Disorientation in time and space can also develop, leading to confusion about the time of day, the current year, or even the identity of people close to them. These changes can be distressing, both for the person experiencing them and for their loved ones, and they highlight the importance of early recognition and support. Incontinence. Loss of bladder or bowel control is a symptom that typically appears in the later stages of dementia, often impacting a person's independence, dignity, and overall quality of life. The individual may no longer recognize the body's signals that it's time to go, forget where the bathroom is located, or be unable to reach it in time. This can lead to episodes of embarrassment, confusion, and even hesitation to ask for help, especially if the person feels ashamed or frustrated by what's happening. In some cases, they may try to hide accidents, which can create additional challenges for caregivers. Other contributing factors may include limited mobility, reduced ability to communicate needs, or difficulty maintaining familiar routines, such as using the restroom at regular intervals. Addressing this issue with sensitivity and proactive care strategies can greatly improve comfort, preserve dignity, and reduce distress for both the person affected and their caregivers. Repeated questions. Asking the same question repeatedly, such as what time it is, when a meal will be served, or the date of a doctor's appointment, without recalling the answer, is often a clear sign of short-term memory difficulties. This isn't done on purpose. Rather, it reflects the brain's struggle to retain new information, even for a few minutes. While this behavior can understandably lead to frustration for both the individual and their loved ones, it's important to respond with patience and understanding. Over time, this symptom may become more common and may extend into other areas of daily life, such as repeating stories or forgetting recent conversations. Recognizing this as part of the condition, not a personal choice, can help everyone involved respond with greater compassion. Hallucinations and disorientation. Some individuals with dementia may experience visual or auditory hallucinations, seeing or hearing things that aren't there. This can be confusing or frightening, especially if they believe these experiences are real. Disorientation in time and space is also common. They may get lost in familiar areas, forget how they arrived somewhere, or mix up the time or day. Some may dress inappropriately for the weather or occasion, or try to leave the house at odd hours. These episodes can grow more frequent and pose safety concerns. The importance of early diagnosis. Spotting these signs early helps in adopting strategies to maintain quality of life and slow cognitive decline. Keeping the brain active through reading, logic games, or learning new skills strengthens neural connections. A balanced diet, rich in antioxidants and healthy fats, along with regular exercise, supports brain health. It's also essential to plan ahead, adjusting the home for safety, setting routines, and discussing long-term care options with family. These steps improve not only the life of the person affected, but also ease the burden on their loved ones. Advances in research. While there is no cure yet, research is progressing. New treatments are being explored to slow dementia's progression, such as cognitive stimulation therapy, personalized exercise programs, and brain-healthy diets. Scientists are also investigating medications and genetic therapies aimed at reducing protein buildup in the brain. Early detection through biomarkers is gaining momentum, allowing doctors to identify brain changes before symptoms appear. These breakthroughs bring hope for more effective treatments and better quality of life for those living with dementia. Emotional support. Living with dementia is undoubtedly challenging, but no one should have to face it alone. Having a strong support system, from family members and close friends to specialized caregivers and community groups, can significantly ease the emotional burden and create a more understanding, compassionate environment. Patience, empathy, and simply being present are essential in helping those affected feel seen, heard, and valued. It's important to honor not only their memories and emotions, but also their unique life story and identity. Even as abilities change, the person remains worthy of dignity, connection, and love. Sometimes just sharing a moment, a smile, or a familiar song can bring comfort and joy. In the journey with dementia, human connection can truly make all the difference. Conclusion. Dementia is a growing global challenge that affects millions of individuals and families worldwide. But recognizing the early signs can truly make a difference. Early detection not only opens the door to more effective management strategies, but also allows us to provide meaningful support, preserve independence longer, and improve quality of life for both the person affected and their loved ones. If you found this video helpful, please consider leaving a comment below. Your thoughts, questions, or experiences might help others who are going through something similar.